Cathérine Gebhard is one of the leading researchers in gender medicine in Switzerland. In her research project, she and her team examined the differences between men and women in SARS-CoV-2 infection.
We discovered quite soon at the beginning of the pandemic that there are major gender differences in the course of the disease. That we don't even know why these differences exist, and that was the reason why we decided on this project, precisely to investigate these things in more detail.
And how did you realize this project?
On the one hand, we wanted to look at biological differences between men and women and how these influence the course of the disease. And on the other hand, we also wanted to look at socio-cultural differences. For example, the risk behavior of men and women, how they are exposed to the virus, and we then combined all of this in one project.
What were the results of your analyses?
We were able to show that men were more severely affected by the acute illness, they were more seriously ill and also died more frequently from it. In contrast, the long-term consequences of the disease, known as long COVID syndrome, were much more common in women than in men.
Which factors are responsible for an increased long COVID risk?
We have seen that the living situation plays a role for women in particular. So living alone was a risk factor, but also having an increased stress level, being a single parent or having a low level of education. As protective factors, we found that having the highest income in the household was a protective factor, particularly for men.
What benefits has your research had during the pandemic, and what are your goals for the future?
During the pandemic, we were able to identify the risk groups that were most severely affected. These were the men with the acute illness and the women with long COVID syndrome. We were also able to show that if a woman is also so severely ill that she has to be treated in hospital, the survival advantage of women disappears for some reason. We were also able to show that despite the more favorable acute course, women are more affected by the long-term consequences, and we were able to identify the factors that favor this. However, we have also seen that there is still a lot of research to be done on the socio-cultural differences between men and women. So, how can we best measure gender? There are differences between countries, differences between generations, and there is still a lot of work to be done here in Switzerland in the future.